Thanks everybody for coming out to pitch day for 100K. It's always a great day to pitch. This, I believe, is our 24th pitch day of the year, and it's our final one. We are going to be taking a couple of weeks off. We're coming back in early January for CES week. So stay tuned for exactly when and where that one will be. But it will be the week of CES. So it's always a great day to pitch. Today, we're going to hear from Glenn Lumis at Query Health and Ephraim Makube from Hutano. It's been a little while since we've heard from Ephraim. Can't wait to hear his update. Congratulations to Glenn and Ephraim on making it through our gauntlet of qualifications to get here to pitch day today. We hear from about 10 founders who want to pitch for everyone who gets to. So good on you for getting through. StartUpNV is Nevada's statewide nonprofit startup accelerator and incubator. We operate 7 free programs for entrepreneurs and 4 for-profit investment funds. Government grants and corporate sponsors support our nonprofit mission in the short term. And over the long term, we're supported by the accelerator companies who donate a tiny amount of their equity to the nonprofit, and our investors who donate a portion of their profits to the nonprofit. So hopefully we won't be dependent on grants forever. We run Pitch Day for 100Ks fortnightly on Wednesdays, where companies pitch for the Q&A and for entry into the accelerator program, which comes with an investment from FundNV. Now, added to that investment are additional investments from our investor syndicate, plus a matching amount from Nevada's SSBCI program. Since 2021, our funds and our syndicate have completed 30 transactions in 21 companies, directly investing $9.4 million. Partners like GoEd and others have invested alongside us, making our total amount of investment about $30 million. Now, that's an average of $500,000 per company if you're counting or doing the math. That's for us directly, or $1.5 million per company, including our partner investments. That $9.4 million that our group's invested directly is currently worth $27.3 million. So it's a pretty good track record for investing over the past almost 4 years now. Now for the legal disclaimer. The founders pitching today for investment are pitching to our venture funds and our venture syndicate, which comply with SEC and Nevada Certified Investor Regulations. We invite the whole community to attend and watch online afterwards for educational purposes, kind of like watching Shark Tank, hopefully a little bit nicer. Once again, the pitches today are not a general solicitation for investment. So end of disclaimer. Our nonprofit work would not be possible without the financial help from grants and sponsors, like the ones we have from the City of Las Vegas, Clark County, the Governor's Office of Economic Development, the EDA, the USDA, and others. Thank you so much for your support. And as far as other announcements, Angel NV is starting again in January. So for founders, that means we're going to make at least a $200,000 investment in one Nevada company. So if you're a founder out there and you're interested in a $200,000 investment that will be matched by the state of Nevada, so a $400,000 investment, be sure to visit us at angelnv.com and apply. If you're an investor and you are interested in learning how to be an angel investor and how to do due diligence on companies, how to evaluate their valuations and all the other factors in them, you can join as an investor in Angel NV. It's a $5,000 investment, and you get to help us screen the companies, you get to help do due diligence on the companies, and ultimately, we vote as a group to invest in one of the companies that comes through the program. And the last 4 years that we've done this, we've actually invested in 2 companies each year, but it's up to the investors each year. If we get over $200,000, exactly what happens with that extra money? Do we put it all into one company? Do we split it up between 2? Or exactly what happens? That's up to the investor group. So no telling what's going to happen. So tune in January through March to figure out what we're going to do with Angel NV. And we hope that you'll join us either as a founder applying for the money or as an investor learning how to do angel investing. So that's all of the announcements that we have for today. So Glenn, you are up, my friend. You're up first. And so you'll get 10 minutes to pitch. As soon as we see your slides, I will go and sit down, and I'll come back up when it's Ephraim's turn.
All right. Thank you so much.
All right. So whenever you're ready, begin.
All right. Thank you so much. Good afternoon, everyone. I'm Glenn Lumis. I'm one of the founders of Query Health, and I'm very excited to share our plan to put AI medicine in your pocket. Sorry, I'm having a little trouble with my slides here. Apologize. All right, let me start with a story to illustrate the problem. My partner's uncle was having pain for many weeks. He sought treatment many times from a bunch of different providers, but nobody could figure out what was wrong. Unfortunately, he had forgotten to tell his providers about the melanoma that he thought was cured over 5 years ago. By the time he remembered and told his doctors, it was too late. This scenario is repeated over and over again across the country. The problem is having our medical data spread among multiple entities and unavailable when we need it. We have all shown up to a new physician to be greeted by a clipboard and then by 100 questions from a nurse and a doctor. And we all wonder, shouldn't they already have this data? Most of us have had that sinking feeling of freezing up and forgetting to give them the crucial information, leading to problems in our care. Wouldn't it be great if we never had to fill out that form ever again? Also, some of us delay care due to fear, scheduling, or cost issues. Instead, we seek information from Dr. Google, WebMD, or ChatGPT, which are only as good as the information we give them, which is often incomplete and inaccurate. Wouldn't it be great if the resources already knew your information? The solution to this is a unified source for patient data, owned and controlled by the patient, not the health systems, one that makes it easy for patients to input, retrieve, and share their data. One that provides a complete health record that makes it easy for AI to provide insights into health and healthcare directly to the patient. In short, what we really need is an AI physician in our pocket. Enter Query Health. Our product makes history taking easy, using a voice agent to have a detailed conversation with you, much like a medical student or a doctor would do. It also extracts data from your scanned documents and photos. In a few short sessions, your entire medical history can be input in the comfort of your living room. Data recall is effortless, and you can ask the AI to find and trend any data in your record, as well as explain terms or concepts you don't understand. It's simple to share your information using a QR code that allows your doctor to print or download your data. Helpful hints about healthy living and prevention are sent for your consideration. You can also tell the system of any current symptoms or issues, and it'll give you a list of possible diagnoses and treatments tailored to your unique medical history. This is our very simple interface, the Circle of Health, which shows all of the major areas of health information and your progress towards completing each area. Let's take a quick listen to our application in a scripted interview with a patient. The general questions are scripted since the AI agent is still in training. Listen to how conversational the technology is and how it extracts information from the conversation and updates the record and the Circle of Health to show the patient's progress towards completing their record.
Good afternoon, Emily. I see that it's been a while since we updated your medical record. Would you like to review and add any new information?
Yes, let's do that. I want to make sure everything is current before my upcoming appointment.
Great. Let's start with your medical history. Last time we noted your allergy to penicillin and your diagnosis of asthma. Have there been any new medical conditions or hospitalizations since our last update?
Actually, yes. I was diagnosed with hypertension 2 months ago.
Thank you. I'll add hypertension to your list of chronic conditions. Are you currently taking any medications for this?
Yes. I'm taking lisinopril, 10 milligrams once daily.
Noted. Any side effects or concerns with this medication?
No side effects so far.
As you can see, it's very much like talking to a doctor in the office. Once you've entered your information, it's yours to own and share forever. All you need to do is scan the QR code in the app, and you can print or export a fully formatted record of your entire medical history that looks much like the screen you're seeing. Let's turn to our competition, which is as fragmented as the healthcare data. Most of our competitors focus on serving health systems and insurers, not patients. Nobody is creating the type of patient-centered ecosystem that we envision. We also have 3 unfair advantages. We are experienced founders. We have access to 20,000 doctors and 1 million patients through our EHR partner. And we have a full engineering team already in place that has previously built healthcare AI tooling. In short, we're targeting the white space in the market and doing so with a built-in head start. The healthcare AI market is large and growing fast. Targeting the white space for patient-facing AI medicine, we believe growth can be exponential. Leveraging our EHR partners' 1 million patients will create momentum from the start as these patients adopt the technology and tell their friends and family. Getting to more than 3 million patients in 4 years with this type of tailwind is very achievable. Our business model is a subscription model. Our basic version will be free and contain ads. It will be limited to history taking, data upload and retrieval, and QR-enabled data sharing. Our connected version will upload data from health information exchanges on a regular basis and allow other connected information to flow into your record. Our Insights version will provide health insights and tailored medical information. All of our subscription versions will be ad-free. The pricing is based on our projected costs at 60% gross margin, but of course this pricing still requires validation and will most likely change as we learn more about our patients. Speed to launch is baked into our plan. We will leverage our EHR partners' 1 million patients as a jumpstart to getting this product into the market. After this initial salvo, our growth strategy will focus on patient incentives, followed by adding a partnership ecosystem that offers testing, monitoring, and telehealth to patients who need these services. Once we have great data on usage and outcomes, we will look to partner with insurers who should be very interested in having this expanded view into their patients' data. We have a very experienced team who enjoy working together. Glenn, Nate, and Javier are physicians who have designed healthcare IT systems focused on patient and provider experience in the past. Amaya is a brilliant technologist who is great at making our vision come to reality using onshore and offshore assets to keep costs down and to keep quality up. Behind us is a full healthcare IT team that is experienced in creating great products for patients. We are looking to raise at least $1 million to complete our application market testing. We've tested many of the pieces, but we still need to integrate them into a single application and finish training the AI agent, which is our major IP. Ensuring product market fit is the key for this stage of our development. So you can see that 45% of the money will be used for technology, 20% for marketing, and 15% or so for legal issues. We're looking to use a safe contract at a 20% discount for this early round. All of our founders are currently expending their time and money on this project, and we expect all of them to work full-time for Query Health moving forward. We also are fortunate to have one founder with multiple exits who is guiding our efforts. With this funding, we will be well on our way to success. Wouldn't you want to have one of our AI doctors in your pocket? I appreciate this opportunity, and I look forward to your questions.
Just as we wrap up here, thanks to Ephraim and Glenn for presenting today to the viewers and participants on, and just a few other notes as we wrap up. Investors, if you're curious about how to become an investor, please reach out, especially since we have our Angel NV program coming up soon. We made our first capital call for Fund NV2, our pre-seed fund that does investing in the companies just like you saw today. And then 1864, our seed fund, $10 million seed fund that invests in companies a little more mature than the ones you saw today, is also going to be making its first capital call here in the next few weeks. And if you get involved in any of those things, you become a member of our investor syndicate, so you get access and look at all kinds of deals that we see through this process and others that we monitor and source. And thanks again to Glenn and Ephraim for pitching today. So the next time we're going to see you is in the first week of during CES week, which is the second full week in January, the first full week in January, the second Wednesday in January. So be sure to tune in for where we're holding it and when we're holding it. It's always a little different during CES week. And then we're going to hear from 2 additional Nevada startups at that time. Until then, take care of yourself. And if you can, someone else too. We'll see you